Hi everyone! So everything that's covered in this short video is all about Kawasaki disease. So what is Kawasaki disease? Kawasaki disease is a vasculitic disease in which medium-sized arteries throughout the whole body become inflamed. It was first described in 1967 by Dr. Kawasaki. It typically affects young children but can sometimes affect teenagers and adults. It is usually a self-limited condition with fever and manifestations of acute inflammation for at least 5 days, lasting for an average of 12 days without therapy. Early symptoms which can last up to 2 weeks may include high fever, rash, bloodshot eyes, bright red swollen lips, strawberry tongue, swollen lymph nodes, swollen hands and feet, red bumps and soles of the feet. Heart problems may also appear during this time. Later symptoms begin within 2 weeks of the fever, so other signs and symptoms may include abdominal pain, vomiting, diarrhea, enlarged gallbladder, and temporary hearing loss. A severe complication of Kawasaki disease is a cardiovascular disease which most commonly presents as coronary artery aneurysms and can lead to arrhythmias, myocardial infarction, and heart failure. So typically, an ECG and echocardiography are done in individuals with Kawasaki to look for cardiovascular involvements. Echocardiography is the study of choice to evaluate for CAAs in both fully manifested and suspected and complete cases of KD. Cardiac angiography provides a more detailed study of the arteries, but it is associated with greater risk of rupture, especially when performed in the acute phase of the illness. Infusion of an immune protein through a vein can lower the risk of coronary artery problems. Kawasaki treatment is a rare exception to the rule that says aspirin shouldn't be given to children. Aspirin has been linked to Reye syndrome, a rare but potentially life-threatening condition in children recovering from chickenpox or flu. Once the fever goes down, your child may need to take low dose of aspirin for at least 6 weeks or longer if he or she develops a coronary artery aneurysm. Aspirin helps prevent clotting. However, if your child develops flu or chickenpox during treatment, he or she may need to stop taking aspirin. Taking aspirin has been linked to Reye syndrome, a rare but potentially life-threatening condition that can affect the blood, liver, and brain of children and teenagers after a viral infection. If your child has any signs of heart problems, the doctor may recommend follow-up tests to check your child's heart health at regular intervals, often at 6 to 8 weeks after the illness began and then after 6 months. And if your child was given gamma globulin, it's a good idea to wait at least 11 months to get the chickenpox or measles vaccine because gamma globulin can affect how well these vaccinations work. So that's all for my video presentation, guys. Pasensya, husky. Thank you!